Hi everyone, and welcome back to Health Angel Solutions. The most widely prescribed medication for thyroid disorders worldwide is levothyroxine, which is available under various brand names in different countries. If you have a thyroid disorder such as hypothyroidism, low thyroid function, or Hashimoto's disease, it's likely that you have been prescribed this medication. Today, I'm going to share some new and shocking findings from a recent study with you. But first, I want to make it clear that this video is not meant to advise you to stop taking the medication or switch to a different brand. I'm providing this information for you to discuss with your physician so that you too can decide what's best for you. With that said, let me share with you 3 startling truths based on research studies that have surfaced. The first shocking truth is that a recent study suggests that you might not require levothyroxine medication to treat your thyroid condition. Yes, you read correctly. This research study suggests that the medication may not be helpful for people with subclinical hypothyroidism. When you have subclinical hypothyroidism, the only aberrant value found during thyroid blood work is an abnormally high TSH level, while the other thyroid values, such as your free T3 and free T4, are within the normal range. You should first check to see if you have completed all 3 TSH, T3, and T4 tests. If you have, and the only abnormal value is TSH, and your TSH is between 4 and 10, and your T3 and T4 are within the normal range, you may not require medication because a study that followed 2,192 patients with thyroid disorders for more than 5 years found no substantial improvement in their symptoms. Neither morbidity nor mortality showed any appreciable improvement, nor did the probability of dying. This means that, despite taking the medication, they did not observe any meaningful improvement in any disease parameter over the course of 5 years, which is why this particular research study suggests that individuals with subclinical hypothyroidism may not require treatment. The study also revealed that TSH can be elevated for a variety of reasons, the primary one being that there is a slight increase in TSH as people get older. The second reason is that stress of any type, whether it be emotional, mental, or physical, can raise your body's TSH levels. The final reason is that, as I previously mentioned, there are certain conditions or individuals who require thyroid medication, so please talk to your doctor about it. If you are experiencing any type of disease, such as a viral infection, parasitic infection, bacterial infection, or any other disease that can also cause an increase in the TSH, it is crucial to check not only your TS, but also your T3 and T4 levels to get the full picture. But first, let's discuss the second startling reality. The second startling reality is that levothyroxine doesn't assist those with Hashimoto's disease understand what the condition is. Thyroid peroxidase and thyroid globulin antibodies are produced by your body as a means of attacking your thyroid gland in Hashimoto's condition, which is an autoimmune disorder of the thyroid gland. The majority of individuals with whom I have worked for Hashimoto's disease have been misled into believing that taking levothyroxine will reduce their thyroid antibodies. Medication containing levothyroxine has no effect on thyroid antibody levels. The traditional medical community actually believes that there is no treatment for Hashimoto's thyroid disease, or at least no effective technique to reduce thyroid antibodies. Nonetheless, in functional medicine, we have developed procedures for individuals who are able to reduce their antibody levels and occasionally even bring them back to zero. The third startling reality is that levothyroxine medication has been linked to a number of negative side effects. The initial adverse reaction that levothyroxine medication causes in certain individuals is increased anxiety, irritability, or mood swings. People who get palpitations or feel as though their heart is racing quickly experience the second adverse effect. The third side effect that patients may experience is bloating or discomfort in their stomach that gets worse after taking the medication. The last startling fact that you should be aware of is based on a recent Swedish study that enrolled 8 million people taking levothyroxine long-term and revealed that women taking this medication had an increased risk of developing cancer over the long term. This elevated risk for stomach cancer and breast cancer in men. It was mostly the higher risk of thyroid gland cancer. And once more, this is a recent study that did demonstrate a connection between a small increase in cancer risk and long-term levothyroxine treatment. The main question now is, how should you treat your thyroid disorder? Is there a safe or natural approach to treat your thyroid disorder? I've included links to both of these research studies in the description so you may read and review them for yourself. Okay, so in functional medicine, we treat thyroid disorders with natural methods. We discuss how food plays a crucial role in healing the thyroid and how certain nutrients are necessary for the thyroid to function properly and repair any damage caused by these antibodies. Furthermore, the influence of diet, lifestyle, and concurrent medical conditions on thyroid health should not be underestimated. Certain foods, supplements, and medications can interfere with the absorption and efficacy of thyroid medications. For instance, calcium and iron supplements, as well as certain dietary choices, can impede the absorption of levothyroxine. This interplay necessitates a holistic approach to thyroid health, where diet and lifestyle modifications complement medical treatment. Patients must be educated about these interactions to avoid unintentional disruptions to their therapy. The revelations surrounding thyroid medicine highlight a critical need for vigilance and informed decision-making. As we delve deeper into the shocking truths of thyroid medication, it becomes evident that the journey towards optimal thyroid health is far more complex than it may initially appear. The nuances of thyroid treatment, ranging from the diversity of medication options to the individual variability in response, underscore the importance of a tailored approach to managing thyroid disorders. Firstly, it is imperative to recognize that thyroid conditions, whether hypothyroidism or hyperthyroidism, are not one-size-fits-all. The course of treatment and each patient's experience can differ greatly. This variability necessitates a personalized treatment plan, often involving a trial-and-error process to find the most effective medication and dosage. While levothyroxine remains the most commonly prescribed medication for hypothyroidism, alternatives such as natural desiccated thyroid, NDT, and combination therapies may be more suitable for some individuals. The decision to switch or combine treatments should be made in close consultation with a healthcare provider, considering the patient's unique symptoms, medical history, and lifestyle. The psychological impact of thyroid disorders and their treatment also demands attention. Many patients experience significant mental health challenges, including anxiety and depression, which can be exacerbated by fluctuating hormone levels. The stigmatization and misunderstanding surrounding thyroid disorders can further complicate the emotional well-being of patients. A comprehensive treatment plan should therefore include psychological support and counseling to address these often overlooked aspects of thyroid health. In conclusion, the shocking truths of thyroid medicine reveal a landscape fraught with complexities and challenges. Patients and healthcare providers alike must adopt a proactive and informed approach to thyroid health. Regular monitoring, personalized treatment plans, awareness of potential side effects, and the integration of dietary and lifestyle considerations are essential components of effective thyroid management. By acknowledging and addressing these multifaceted issues, we can move towards more effective and compassionate care for those grappling with thyroid disorders. The path to thyroid health is not straightforward, but with diligence and a holistic perspective, patients can achieve a better quality of life and improved well-being.